From a patient perspective, a lot of times dry eye just seems like an irritant, something that we can live with. It's not just the feeling of discomfort, it's the damage that's happening at a very clinical level.
Have you noticed that eyes feel chronically dry, itchy, scratchy, or even sometimes watery?
Dry eye is a disease that affects the tear film and all the tissues that the tears are in contact with. The patient's symptoms can vary. It's usually irritation. It may not be painful, it's likely discomfort. As they get more specific, we start to hear symptoms like my eyes burn, my eyes are itchy, I can't keep my eyes open in the bright lights, my vision is blurry and I have to blink to clear it up.
Dry eye disease is a growing public health concern, causing eye discomfort, fatigue, and visual disturbance that interferes with quality of life.
Dry eye can affect patients in a multitude of ways. The most impacting, in my opinion, is on their quality of life. Where itching and burning may seem like a mild irritant, but it starts to impact their ability to do sustainable work.
Itching and burning eyes signal more than just discomfort.
So the symptoms that present are actually signals of damage. And sometimes, if this damage goes on long enough, it may not be reversible.
Making changes through diet, hydration, and adequate sleep can help increase eye moisture and reduce irritation.
Dietary changes include increasing their intake of foods that are rich in omega-3s. Increasing more water is important and will have a direct impact on the composition of the tears. Our sleep is the moment at which our eyes actually recover and heal.
Once lifestyle changes are addressed, lubricating eye drops are often the first line of treatment.
Again, much like brushing your teeth, you use your toothpaste every single day and you brush twice a day perhaps. Drops are indicated for the same reason, to support the tear and tear function. When patients are deciding what type of tear or lubricant to use in the eye, they should consider non-preserved agents. They should also consider their doctor recommended lipid or water-based artificial lubricant, and hyaluronate being one such product that helps enhance all the different layers of the tear film. So using lubricating drops to treat mild, moderate dry eye benefits the tear film in a supportive way. So if you think about your tears like a brick wall, if that brick wall is crumbling, you usually add scaffolding to support it. The other role that your lubricants play is in diluting inflammatory proteins and the salt concentration of the tear. So we've all gone through winters and collected salt on our shoes and see the leather erode. When the salt concentration in the tear goes up, it causes the same type of erosion and damage to the tissues that it's in contact with. So once we've gotten our patients past the mental hurdle of using their lubricants every day, once we've convinced them to do that and that it's going to be helpful, the most common response that I get from patients is one of relief and one of, I wish I had done this sooner. I often tell my patients, if you brush your teeth every day and get a cavity in 6 months, do you stop brushing your teeth? The answer is no. You continue to do it. And dry eye is very much the same way. Using your lubricants will have the same impact. And patients are very clear about their positive response to making that small, simple change.
Dry eye can lead to complications that impair your vision and quality of life. An examination from an eye care professional from the onset of symptoms is of utmost importance.
Early diagnosis in any chronic condition means more effective therapy and management. Leaving this disease undiagnosed and untreated and living with it is akin to living with diabetes undiagnosed. The longer the disease is present, the more challenging it is to treat, and the less effective our treatment options become.
To learn more about dry eye disease and the importance of effective treatment, please consult your eye care professional.